Welcome to World Homeopathy Day. Gratitude to our master Dr. Samuel Hahnemann for his greatest discovery of homeopathy, which is serving mankind for ages together. Thank you HSH team for giving me platform to share my cases on this auspicious day. My gratitude towards Dr. Pradeep Kumar Gupta Sarji, who instilled confidence so that I could handle such emergency cases. I'm going to share two emergency cases of cerebrovascular accident which were treated recently. Case 1. This is the case of 72 years old male patient. I am the member of Vivekananda Kendra. He is husband of our president. On 31st December 2023, I received a call from our president at around 8:25 p.m. that while returning from Pune, which is around 130 kilometers from our place, after attending marriage function, in the car itself, he started feeling uneasy. He couldn't speak, he couldn't swallow, he was sleepy, and he vomited on the way. After vomiting, he is feeling little better, but he is still not well. Can you come and check him immediately? We are reaching in 5 minutes in to our house. So I went to their place in 10 minutes with the VP apparatus and all other things, and they are staying in a bungalow. As I opened the outside door of the bungalow, patient himself came out in veranda to see who is there. So I jokingly asked him, who is sick? He just laughed and said, no, I'm fine now. I'm okay now. I was suffering earlier while coming, but now I'm okay. So the case is like this. In the morning, when they went to Pune for the marriage function, there was no problem. After reaching marriage hall, he started feeling some difficulty while using speech. He couldn't pinpoint what was that problem. He said it was little heaviness. I couldn't talk properly, and there was some problem while using his left hand. He couldn't put on the button of his kurta, uh, but he ignored it. He couldn't understand why it is happening. He just said, maybe I have not taken my regular medicine, so it is happening, or maybe I have traveled for last 3.5 hours, so I'm suffering because of this. So he took his regular medicine, that is antihypertensive, anticoagulant, and then attended that marriage function well, and had lunch in the afternoon. After having lunch, he said, I ate very little, but immediately after having lunch, I started feeling very heavy in abdomen and couldn't understand why it is happening, but ignored it, and then started journey towards Badlapur in car. After crossing 15 to 20 minutes, he started feeling uneasy. There was a lot of perspiration. He started feeling dizzy. He couldn't talk. He felt sleep was overpowering. I wanted to sleep. I was feeling sleepy. But he couldn't understand what is happening to him. There was water, that is tears started coming out from his left eye, and he couldn't close his left eye properly. Even the left corner of the mouth got little distorted, and then saliva started dribbling out of it. He felt dryness in the throat. There was little pain due to dryness in the throat, and he wanted to drink water, but he couldn't swallow it. It just came out of it. uh, he couldn't understand anything. His wife asked, you are not feeling well, shall we go to some hospital nearby? He denied it and said, I will sleep, I will feel better, and then we'll go to Badlapur, and then we'll see what is happening. We'll show in Badlapur itself. Then he slept. Then after crossing half distance in Lonavala, he felt nauseating and he couldn't bear it. So he induced vomiting by himself. But after inducing vomiting, he started feeling little better, and then they reached Badlapur. When on the way, when they were in Badlapur, they called me, and I was there to check him. When I checked him, he was constantly holding towel to wipe out the tears which are coming out of his left eye, and saliva which is dribbling out from the left corner of mouth. He had little numbness and tingling in the left hand also, uh, but he was saying that he is better from the earlier, uh, how he suffered than what he suffered in the car. uh, when I checked him, his BP was 160 by 85, pulse was 70 per minute. He couldn't close his left eye. Uh, as I said, the left corner of the mouth was little distorted. Saliva was dribbling out, and this is the case. And now we have to decide, or I'll have to decide what to do now. What should be the management? Uh, shall I admit him to the hospital, or shall I treat him in the house itself? How will you go about it? Now the next case is, second case is of 85 years old male. This is also the recent case on 9th March 2024. That was a Saturday. In the evening, patient got up from the bed. He is a non-diabetic, non-hypertensive. Uh, he got up from the bed to go for the washroom, and had sudden fall. At that time they noticed that there was paralysis which developed in the left hand and left leg. There was a little slur speech, but he could talk he could eat, he could swallow liquids as well as solids also. Only thing was that the paralysis was set immediately within few seconds. He is the father of Dr. Friend, and he wanted homeopathic medicine along with the regular treatment he will take uh, when he will go for the further management. So this is the second case. This is only history available. So what is the management? How will you go about this? Thank you.